September is Cervical Cancer Awareness Month. It is the most prevalent type of cancer found in women in South Africa, with thousands of new cases being diagnosed annually. Non-profit organisation Right to Care says more needs to be done to create awareness and prevent deaths from cervical cancer. Bridgette Goeieman of the organisation joins us in studio this evening. Bridgette, thank you so much for coming in. It's a very disturbing story indeed. If I'd had to guess, I'd have said breast cancer is the most prevalent type of cancer in South Africa. How has cervical cancer overtaken other types?
Globally, the picture is that breast cancer is the leading cancer. However, in sub-Saharan Africa, because of the high prevalence of HIV, we've actually seen a change in the prevalence with cervical cancer taking precedence over breast cancer, simply because of the modes of transmission between HIV and HPV being similar. So we are finding that with the scourge of HIV being so prevalent, HPV, which is the human papillomavirus, which is the causative organism that causes cervical cancer, is actually transmitted in a similar fashion as HIV, hence the high rates.
So what are the actual causes? I mean, is it simply sexual contact where a woman is unprotected?
Yes, so the causative organism would be your human papillomavirus, which is a sexually transmitted infection, and it is actually the commonest sexually transmitted infection. However, there are risk factors that would tend to make one more prone to developing cancer, and this would be if one started having sexual intercourse at a very young age, having multiple sexual partners in one's lifetime, obviously having other sexually transmitted infections, also having had exposure to other environmental risk factors such as oral birth control use. Also, we find that smokers are also very much higher at risk for developing the cancer.
Does it get passed down from one generation to
No, fortunately this is not a hereditary condition, so it's mostly behavioral and sexually transmitted, so it is not a genetic condition.
How many cases are diagnosed annually in the country right now?
Currently we're sitting at very alarming rates of about 8,000 cases diagnosed annually, of which 4,000, which is 50%, actually succumb to the cancer by dying from it. And it's quite sad because it's a very preventable cancer. A lot can be done to avert these deaths.
Well, talk us through exactly what can be done.
So there are two major categories for preventing cervical cancer. The first would be primary prevention through vaccines. We do have a human papilloma vaccine that is available, very widely available in the private sector. However, in the public sector, the government has rolled it out to schoolgirls aged 9 or in grade 4. One can also prevent it through abstinence. You know, we often shy away from the abstinence message, which is a very powerful tool in terms of preventing cervical cancer. The other major category of prevention would be secondary prevention through going through for pap smears regularly.
So you detect that fairly early.
Yes, yes.
I want to go back to the issue of the vaccine.
Yes.
Now, you've mentioned this age group of 9.
That's correct.
Is there a window period during which young girls can get that 9 to a particular age?
Yes, 9 to 13 would be the advisable age. However, eligible persons would be between the ages of 9 to 26. So anyone who's between 9 to 26 is eligible for the vaccine, provided that you haven't been exposed sexually. So in the private sector, it is available up to the age of 26.
So just to be clear on this, after you've been sexually active, the vaccine is not not useful to you?
Yes, it wouldn't be useful because the main aim is to be vaccinated before one becomes sexually exposed or sexually active. So that is the ideal stage to be vaccinated.
So I understand government has been going around doing these vaccinations.
That's correct.
There is a little bit of resistance to this in community.
Yes, yes. I think education of the communities is very crucial because there is this misconception or the myth out there that rolling out the vaccine to young girls is a form of causing infertility. So I think there's a lot of education that needs to take place around the whole vaccine. It is a very safe vaccine. It is quite expensive, but the government has rolled it out freely for for schoolgirls. So I would really recommend it to parents to sign the indemnity forms, because we had a lot of resistance with signing the indemnity forms.
And you can do that through schools?
Yes, it's part of the school health program currently.
If your school is not doing it and you want to go to a private hospital, do you have any idea what the rough cost of that is?
It is quite expensive, in the range of between 600 to 800 rand, and you need 3 shots of the vaccine to complete the cycle.
Okay, so,
yes.
So how far apart would you have?
So the initial vaccine would be at baseline, and then a month later, and then at month 6. So those are the intervals at which one needs to be vaccinated.
What actually prevents women from accessing these things, particularly older women who simply haven't been taught about this?
Yes. One of the risk factors for developing HPV infection and progressing to cancer is actually a poor education level and generally being misinformed. And we find that a lot of women, one of the barriers to care is a lack of knowledge. So we're currently engaged as Right to Care in robust campaigns to actually inform the general public that there is this cancer that is very common and yet preventable, and that they can actually access the services in their local clinics, your local GP, your local clinic, free of charge, and one can actually be screened for cervical cancer and treated.
Thank you so much, Bridgette. A rather heartening note to end that on. Bridgette Goeieman from Right to Care. Remember that age group mentioned, 9 to 13. If you have a daughter in that age group, a vaccine is available for cervical cancer. Let's recap our headline stories next.